This amazing human being keeps pushing our horizons through her leadership as a clinical scholar, professor of medicine, Keck School of Medicine of USC, the founder and executive director of the University of Southern California Body Computing, and most importantly, my own and best cardiologist. Please welcome Dr. Leslie Saxon.
Thank you. Thank you, Brad. You're great, and I really appreciate and respect you, but when you put a defibrillator in somebody, they kind of need to be nice, but he's super nice, so thank you so much for that, and thank you all for being here, and good morning. This is number 12, okay? That's 12 years of reimagining healthcare delivery, working to fulfill our core mission to modernize healthcare through technology to make it more personable, affordable, and accessible for all. For a dozen years, we were the first. We worked to provide the continuous collection of personal biometric data. And I'm very proud to say collectively, we've accomplished some great things. And you know what? It's given us a little swagger. Kind of like these guys have a little swagger. And we're going to talk about that in my opening remarks and throughout the day and how we can continue to innovate. But we announced every heartbeat in 2012. This idea that we could collect the heartbeat of everybody in the world. And we've been working with AliveCore since its inception, 8 or 9 years. Apple's putting ECG into the Series 4, it's scaling. Our identification of the need to use social networks to support health, knowledge, and care, we designed the first social network and biometric app, Biogram. We now have medicalized Facebook for organ donation and research. Our work to provide a healthcare and enhanced safety experience in cars. We worked with BMW back in 2012, Tesla in 2013, eVelocity in 2018. It's happening. Our virtual care clinic, announced in 2015, surrounding the patient as the customer for all of healthcare with a software and services platform. We've made great progress. We're in this place where we can now accomplish a virtual care clinic or a virtual care hospital. We've entered a stage in which all of the rapidly evolving technology and data are creating a larger context and also a more personal one. Cardiac care, renal care, we're now talking about life care. Life care is and feels very personal. Life care is about motivating a consistent set of informed behaviors where access to information and services is in the individual's control and choice. We are dedicated to helping to create the components of life care and to make sure they are scientifically tested and, as importantly, personally compelling. In life care, bricks and mortar healthcare delivery is no longer the dominant mode because life care isn't just about sick care. It's mostly not about sick care. The majority of life care occurs outside the hospital or clinic. Life care forces us to modify our identities as physicians, hospital systems, solution providers, and patients. Paradoxically, technology is offering us the chance to create a more personally meaningful experience around the most personal thing any of us can have, our healthcare. So as digital health has developed, so has our mission. And this conference is something that makes us so proud because it's really the flesh and blood embodiment of what we do. We work with you all, whether you're an established healthcare provider, creative, we've got cinematic arts here, technology companies entering health, or the performance space with a digital solution. We help payers and large self-insured employers who are trying to leverage life care to reduce sick care costs. And we're proud of our legacy partners. It's been an amazing ride, and we're super excited to welcome our good friends, good new friends, from Baxter and Otsuka into our community, as well as Pacemate. We work, and it's taken us years to define and evolve really strong relationships with our other schools at USC. We enroll not only our patients in our digital health trials, we enroll ourselves. One thing has become very clear to us over the years: you can't dabble in life care. Organizations need to make a strong commitment to digital health care and to align their cultures accordingly, and it has to come from the top, and it has to be funded. Whether it's a traditional payer, a digital behemoth, or a new company with a performance sensor, the future has to be embraced. It requires a deep cultural change to commit to designing digital products that cover the patient as consumer 24/7. We've learned some lessons. When I hear a traditional provider talk about digital healthcare only in terms of risk mitigation, or hear a new technology company say, I want to do healthcare, but will never be FDA regulated, I know that cultural change hasn't happened in their organization, and their chances of true innovation are slim. Yet we are seeing huge progress. Hospitals are looking beyond the electronic medical record. They're 1 to 3 years into telemedicine technology and adoption. Software and services companies are working and getting products approved by the FDA, these same companies that 18 months ago swore they'd never be regulated. They're hiring doctors, creating products for life care. Voice assistants, maybe the new internet. They're already in 60 million American homes, and they're a software build away from transforming every one of those homes into a 24/7 healthcare services. Additionally, tech companies and retail healthcare are creating transparent insurance products, pharma solutions, life care-oriented e-commerce, and facilitating clinical trial enrollment. So digital health research conducted at scale will provide breakthroughs on critically important life care problems, like obesity. Obesity impacts 93 million Americans. That's 20% of our kids, 40% of our adults. These people face higher risks of diabetes, certain cancer, and certainly cardiovascular disease. It's also the main reason why 71% of Americans otherwise age-eligible can't serve in our military. Personalized diets, activity schedules based on individuals' unique metabolic and genetic footprint, backed by large-scale digital research, will lead to food prescriptions, activity prescriptions, government support, and will change the game, and food deserts will become transformed into food oases. We share offices with the USC Institute for Creative Technology that has close ties to the military. ICT folks opened our eyes to the complexity of training and maintaining a resilient warfighter. Optimizing safety during training is a piece we are confident we can help advance using digital technology. But our work is more complex with the military, and it's focused on the use of digital tools to continuously identify key individual physical, psychological, and behavioral attributes. We're working with trainees now, and we're collecting data in real time. We spent nearly 2 years at Camp Pendleton learning the needs and requirements of the reconnaissance training and warfighter community, so we could design a study that actually provided insights that leveraged those experts and gave them aha moments, because they need to graduate more reconnaissance Marines, and they can't afford to degrade the training standards. This was an incredible partnership. The research has the potential to solve complex problems for big military. And I can actually see a future when it's cost-effective to issue a smartphone, watch, and specialized apps to soldiers as part of their life care. Like any revolution, the one in digital healthcare raises ethical issues. It's not enough to keep data secure. Healthcare data has to be handled ethically. How do we convince individuals to contribute their data, their most personal data, without those assurances? Interestingly, this is playing out in professional sports right now. In the NFL, NBA, and MLB, there's a complete lack of trust in the accuracy of player-generated biometric data. Players aren't convinced that the technology won't be used against them. Also, and interestingly, with the Supreme Court decision in May permitting states to legalize sports gambling, there's a pressure to deliver a biometric signal like EKG that can be used to influence betting lines and otherwise enhance the fan experience. But players aren't betting on the games, or hopefully they're not. How do they benefit from giving gamblers their health data? We do this research with the military and elite athletes to benefit not just them, but the 99%. Because if we can solve it for the 1%, we can solve it for them after they are no longer the 1%, and we can solve it for the millions participating in youth and non-professional sports, or the many more millions who just want to be healthier. What better place than California to evolve this industry? This year, we spent a lot of time with the California Governor's Office and core legal, academic, business, and other experts defining basic principles on how to incentivize businesses to create safe and secure digital health products in California. And we're proud to release that white paper on cybersecurity today. One thing is clear regarding life care and cybersecurity. Like environmentalism, cybersecurity is a shared responsibility. Everyone, and especially the individual recipients of life care, share responsibility for protecting life care data. This means new educational and social programs, as well as creation of nimble information sharing policies and forward-thinking legislation that protects patients but does not restrict innovation. Today, we're incredibly proud to host Janet Marchabroda, Head of Health Innovation at the DC-based Bipartisan Policy Center, a wonderful think tank, and Donald Reed from the Pentagon's based Close Combat Lethality Task Force. Janet and Donald are going to help us gain insight into how our government is thinking and acting in response to the potential of digital health. And it's not just healthcare that's radically changing. Another industry changing as much as healthcare is automotive. Los Angeles, we're home to the 405 freeway, the busiest highway in the nation. We're the poster child for the traffic jam. But we've also fast become the most important automotive innovation center in the world. Tesla is just one of scores of automotive innovators in LA. Cars have connected cameras, scales. Cars can take your temperature or blood pressure. Cars can pull themselves over if they observe a driver texting or sense an illicit substance use that's impairing performance. Cars can not just transport you to clinics, cars can be clinics. Cars as a service have the potential to improve life care outcomes. Finally, unlike sick care, life care is continuous, distributed, crowdsourced, and personal. The massive potential of the new paradigm for delivering health places individual responsibility and accountability on each participant to make it safe and make it work. The payoff is a real jackpot, however, one continuously improving system that provides agency and vital information to the individual, no matter their circumstances. We have the ability to create this system with the talent and organizations within the country, the state, the city, and this room. Let's talk with each other today, consider the great opportunities that are open to us all, and use that knowledge to create what can be one of humanity's greatest accomplishments. So let us know if we can do anything for you today. We're all around. We're going to SWAT team you. If you need anything at all or you want to meet somebody, let us know. Our staff is everywhere. Enjoy the day. And again, we're honored to host you here.